Hi, this is Claire with CORE Therapy and Pilates. Today I just wanted to go over a few of common posture problems, how these problems tend to come about, and solutions to help get us out of those posture problems, okay? So first we'll start with low back. A lot of common issues you can see with the low back are excessive lumbar lordosis, so that's when the back is more sway like this. Flat back, when the pelvis is tilted more posteriorly and it's flat right here. Then we have thoracic kyphosis, which is when you're hunched over like this, and forward head posture when your head is leaning forward like this. So a lot of these problems can come about with our day-to-day activities. We tend to sit a lot as a as a population. We have to sit a lot for work, especially if we have desk jobs. So I just kind of wanted to go over, how the importance of having an ergonomic setup like I have here. So I'll pan over and show you. All right, so right here I have my main monitor, which is what I use, and I've got my blog right here on my laptop. Notice how if I were to have a laptop here and an elevated monitor, I would be in that forward head posture. So I would have really tight suboccipitals and lengthened deep neck flexors along with tight pecs, and that forward head along with the thoracic kyphosis posture. But when I make sure I'm looking at my monitor here with my keyboard level, my eyes are right at the monitor. I don't have to lean forward to see what I'm typing, and I'm able to sit with an upright posture. Now, usually if you're working an office job where you're having to sit a long time, I would recommend having an office chair with good lumbar support. As a PT, I don't really sit much, so I have a rolling stool. But if I ever do need to sit for a longer period amount of time, if I need to document more, like I'll get a more stable chair and add like a towel for a little bit of a lumbar support. But yeah. So when you're sitting, your hip flexors can tend to get really tight. And when that happens, that's when we get pulled into the lumbar lordosis that I showed you guys earlier, when your low back is arched. And it's important to help to address that by, number one, getting up every other hour or so while you're working and stretching or releasing that psoas muscle that pulls the low back into extension. It's important to also stretch out your pec muscles. So these right here. So when you're slouching over and typing all day, they can get tight, especially your right one if you're right-handed when you're working with your mouse. That can get tight. So it's important to release those as well. Some exercises that you can do throughout your workday to kind of make sure that you're staying in check and avoiding those positions include chin tucks, which I'll show you real quick. You can do them even while you're sitting at your desk working. So for a chin tuck, you want to tuck your chin back this way, almost making a double chin, okay? You can use your fingers to help guide you, but they are not necessary if you feel like you don't need them. Kind of helps train you out of that forward head posture. So this is one that I'll sometimes suggest for people as appropriate if they need it throughout their work day. So that one, and then of course it's always nice to have access to a standing desk so you don't have to be in that slumped position all day, which also your office chair with the lumbar support helps. So I usually like to suggest either changing your desk from sitting to standing every other hour, or getting up and walking around every other hour if you don't have access to a standing desk. So those are just some quick tips that I wanted to share about how to become more conscious of your posture throughout your workday. Have a great day.